Ellis. I'm going to be speaking a little bit more about the day-to-day interactions between myself and my individuals and how those could be impacted by an increase in funding. So I'm a DSP at a local residential treatment center as well as a shop steward for SEIU. At a time when I was unsure of my own path in life, I decided that I would help others along theirs. I applied for my first official direct care job besides babysitting previously. In my interview, I remember they asked me how long I thought that I could commit to the agency and how long I could be a part of their campus. My answer was 1.5 to 2 years. Turns out this was very flawed. Once I came to know my individuals, and a really extreme attachment was formed. This is now my 4th year there. After settling into my new job, I began to notice that my colleagues were frequently leaving for other employment, or that they were very new employees themselves. Those that chose to leave often indicated that they had been burned out and they knew that they had a chance to earn more at jobs that had far less responsibilities, typically those outside of human services. Due to high staff turnover, veteran employees are often expected to perform at low or unsafe staffing ratios, which is being kept out of parameters. These staff aren't compensated to run units that are out of parameters, and we're being underpaid for this as well. So it results in staff leaving to seek lower risk forms of employment, because things that do happen in human services can affect you on a criminal level if there's an abuse or neglect charge. When units are short-staffed, staff are forced to maintain basic safety and security of residents, but we're unable to do much things besides. One aspect of therapeutic crisis intervention, which is also known as TCI, it's an aspect of preventing and safely transitioning a resident out of crisis. One of the 3 outcomes of recovery is the highest form, which is educateur. That's in which the resident and the DSP work to practice a learned skill and transition them to have a better reaction to their next crisis or their next downfall in life. The outcome, unfortunately, that we see the most is the middle, which is known as firefighter or no change. When we're working at the firefighter level or experiencing no change, you kind of see a staff that's running around, essentially like the chicken with their head cut off, running around from crisis to crisis to try to stop the next big crisis from happening so that the unit's basic safety needs are met. Unfortunately, this puts a damper on doing things like homework, teaching life skills that can be used to the next program, or to transition that resident into a safer environment. So I have had several shifts recently where I've been single staffed, 6 to 1, which is down 2 staff, so where there should be 3 of us, there's 1. In these situations, things like helping with the homework, as I said before, and practicing life skills do fall by the wayside. And it is a struggle to ensure that their basic needs are even met at this point when you're that short-staffed. As a whole, our industry really needs to do all it can to assist and empower DSPs to avoid the lowest recovery stage, which is unfortunately abuse or neglect. This should not be happening at all, and it should not be happening as a result of lack of staffing. If funding for wages was to be increased, a direct positive impact on hiring and retaining staff would be seen. Staff that are paid fairly would be returning that investment by being more likely to remain in the field and more likely to form important bonds with the individuals that we serve. An increased amount of funding is important to myself especially because it would enable myself and my colleagues to care for our residents in the best way possible. Very rarely have I known a DSP to apply and retain employment for the pay. We apply and we stay simply because we care and we form bonds with our individuals. We see how a little time and a little more effort positively impacts our clients, and we would like better tools to help our sometimes disadvantaged individuals take better advantage of what our programs have to offer. And that's it.